We see hypothyroidism in up to 10% of cats over 10, and it's generally a result of overactive thyroid tissue. Those cats that are eating a lot, but they're losing weight and losing muscle mass, and we might go on to see other signs like gastrointestinal signs. They're drinking a lot, they're urinating a lot, their behaviours might change. Radioactive iodine is ideally the gold standard of choice when it comes to treating hypothyroidism. It is a definitive treatment, so we have reported cure rates of between 94 and 98%, and it means that we're actually destroying that overactive thyroid tissue rather than trying to manage those thyroid hormones with medication over time. If we are just managing thyroid levels with medication over time, those overactive thyroid cells continue to grow and develop and can transform into a malignant carcinoma. So using radioactive iodine to destroy those cells is really ideal in that we're removing that risk away from the patient. It also means that we see a better bond between the owner and their pets. They're not having to medicate them once or twice daily, which can be really stressful.
Typical therapy day starts with the cat being admitted. They come in and receive some mild sedation through a cannula that's inserted by our feline vet. Once this is done, through the same cannula, they get an injection of a radioactive tracer. This isotope goes into the thyroid gland and allows us to image it on our camera using gamma rays. This tracer has no associated side effects to the cat. After about 10 minutes from the injection, we start scanning them, and that allows us to see the structure and the function of the thyroid gland. This is really important in assessing whether the patient is suitable for this line of treatment. And then once we can assess that, we can tailor the dose based off the findings of the scan and administer the iodine.
The isolation ward post-treatment is set up with the welfare of our patients in mind, providing substantial environmental enrichment to make their stay as comfortable as possible.